Welcome to the Gain Momentum podcast. We have a very special episode today focusing on the future trend of dental longevity. I'm joined today by Dr. Jonathan Levine, founder of Smilehouse. Dr. Levine, how are you?
Oh, I'm great. And thank you so much, Adam, for having me here.
Well, it's an absolute pleasure to have you on because this is a immensely important topic to discuss, as well as an incredibly lucrative topic to discuss. So first, let's start with the elevator pitch for Smilehouse. What is this new type of dental clinic, and how does it tie into this term dental longevity?
Yes. Well, we believe that oral health leads to overall health.
Mhm.
What we believe is that dentistry needs reinvention from a standpoint of our diagnostics, using new technology, the experience of the patient, that patient journey. And we're very focused on creating an environment that will exceed any expectations and put patients in a mindset of relaxation, let that parasympathetic mode hit where that they intake the information that we can figure out for them through our diagnostics that we call mouth mapping. So
Mm.
the elevator pitch, that was a little bit long, but what I would say if you ask me, what do you do for a living? What I would say is that we create the most beautiful, healthy smiles for people, and that's what we're focused on.
And as part of the overall why care, I'm a busy hotelier. Why should I care about this? Can you give us a quick summary of how dental health relates to overall health?
Of course. The mouth is part of the human body,
Mhm.
and for way too long, it's been disconnected between dentistry and medicine, really for political reasons.
Mm.
Because of that connectivity through the superhighway called the circulatory system and even the digestive system, that when the mouth has the issues of either gum disease or breakdown of the teeth, the demineralization, there's a direct connectivity to the rest of our body. And so, what does that mean? These microbiome of the mouth, just like the gut, when it goes into a disease state called dysbiosis versus symbiosis, which is that great, nice, healthy balancing act. Once
Mhm.
that gets thrown off by the environment that we put our body under, that inflammatory disease, because of the colonization of these bad bacteria, will wreak havoc on our body. And we see it in these systemic inflammatory diseases like cardiovascular disease, Alzheimer's disease, diabetes, leaky gut, on and on. In fact, 57, everyone you could name today, 22 years later of science, shows direct connectivity to inflammation of the mouth. So it's really so important to get on our oral health game because it's so preventative. We have complete control of this.
Yeah, and I love you're using the term preventative because a big part of the growth of hospitality is investing in preventative medicine and partnering with these longevity clinics that can supply those diagnostics to give people the early warning signs to correct problems before they materialize into something that is potentially life-threatening.
Exactly. That's
Yeah.
exactly right. That's exactly right. The hotels, as discussing earlier, it creates that environment for people to just kind of calm down. And in that temperance mode, that calming mode, you're open to learning how can we live longer? How can we have healthier, better lives? And so it really works so well in that integrative approach.
Well, on the note of calming, you also mentioned another important term here, which is the parasympathetic nervous system. Can you tell everyone who doesn't have a undergrad in pre-med what the parasympathetic nervous system is and how that relates to stress and how you approach anything in a more calmative state of mind?
Yeah. Well, You gotta go back a long time. You gotta go to the Stoic philosophers and listen to Marcus Aurelius about this because the truth of the matter is temperance and calming is the way to solve issues. We like to say in my family, it's not the problems we face, it's how we face our problems. And so when we're faced with something that can excite us, and in the old days, maybe it was a dinosaur running at us, fight or flight kept us alive, and
Mhm.
that's the sympathetic mode. We go into fight mode right away, and the cortisol and the adrenaline is pumping. But what we're forced to do to get into more calming and not as reactive, but more creative, where we really think through whatever we're facing so that these problems are more of challenges and they're really exciting to solve them because we can solve them not by being knee jerk reacting, but really by sitting down and having the temperance and the calming mode to think through it. That, as we take a long exhalation, puts us into parasympathetic mode,
Mhm.
which through the vagus nerve drops our heart rate, allows us to think clearly because we're not in that fight or flight mode, because it's the two systems, parasympathetic and sympathetic, of our human body, of how we can react. So it's up to us. It's just up to us.
Wow. And hotels these days, they don't specialize in the patient experience, they specialize in the guest experience. But what you've essentially done is take elements of hospitality and the mission of bringing guests into a hotel and bringing them into that parasympathetic state and applying those principles over to a dental clinic. Can you
Yes.
discuss some of the features and amenities you've applied from hospitality into the dental space?
Absolutely. We talk about it all the time, and we talked about it as we were designing and thinking about this.
Yeah.
Having been in dentistry over 35 years and built multiple offices and started different companies within oral health,
Mhm.
it was so obvious. I've always been a clinician that when a patient walks into a dental office, the five senses are so critically important
Mhm.
to think about and address. So if the smell of eugenol, if the look of scary equipment, of the thought of a drill and a needle, of people at the front desk with their head down that doesn't acknowledge you, on and on and on, all these visual and all these different sensory cues are negative. By the time you get into the dental operatory, you're looking for the window to jump out of. And so the truth of the matter is we have to create an environment that flips the script, that all of a sudden the five senses and what I told our team, and my team starts with my family. I don't know if you know this, but we started Smile House with my family because they watched me in the profession and I'm in different aspects of it. And I was very fortunate to have two sons who decided they're going to go into the family business. My wife's helped me start two companies, Go Smile and Glow Science. And so she understands branding, marketing, and really the whole profession. So everybody was on the same page. Let's do something different, something transformative, something's reinventing. So when you walk into Smile House, you feel like you're walking into a great hotel or a members club. We all read an amazing book, Unreasonable Hospitality,
Mhm.
evidenced by the TV show The Bear as he held it up and read it. But Levin Madison and Will Guidara, who wrote that book, really set all these industries on fire, where we think about all of these little details that changes people's not only their expectations, oh, but oh my God, their amazing experiences.
Mm.
Unreasonable because it's so far out there, nobody would have even considered it. And that's what we wanted to do. We thought about the patient journey. And it's so interesting. Think about the environments we go into. Epigenetics, the environment we put our body in. Well, the visual cues are just like that. So with Will Guidara's book, Unreasonable Hospitality, just that experience that goes way beyond anybody's expectations, beyond anything that they would even think would happen in a restaurant. That's what we wanted to happen in our clinic. So we look at our Smile House on three legs of the stool, we'll call it. We look at it unreasonable hospitality. We're creating this incredible environment so that it brings everything down. Any angst that they might have all of a sudden, whoosh, Parasympathetic kicks in.
Mhm.
Now they're looking around, it's like a whole library with great books to read. They're received, nobody's behind a desk with their head down in front of a computer, just like a cool hotel or a members club, and you're sitting down on these comfy couches, and you're just taking it all in. The ceilings are 17-foot high, it feels like a cool, kinda warm, the colors are amber, and that sets the stage.
Mhm.
It sets the stage for what's about to happen. With an esthetician and jaw release massage that every patient gets as they walk through that area to, let's say, our tour of the space, we can explain who we are and what we do. But the environment has allowed us to put people's mindset just in the right place.
Wow. It's so tremendous how you're talking about the treatment around the treatment, and that creates just something so magical where it's almost like 5 years from now, people will say, "Oh, I'm looking forward to I have a dental appointment. Oh my god, yes." Like, it's like the highlight of their week sort of thing, right?
I have to tell you, I just left a few patients, and Tara's here, who is our esthetician,
Mhm,
and I have to tell you, it's just on a Friday afternoon to get a stress release jaw massage, and we do extraoral and intraoral, and it's just so incredibly calming with the oils that they use, and,
mhm.
we hold so much stress into our masseters and our temporalis
Yeah.
frontalis muscle, and it just 20 minutes of that, oh my god, it's as good as any spa you can consider going to.
Well, it's interesting. Before we hopped on the call, you mentioned the relationship between dentistry or mouth health and sleep. And this is a huge growth area for hotels. And now you're talking about getting people into a parasympathetic state, as well as just any sort of jaw massage that would bring them even deeper into that parasympathetic state. How does mouth health and dentistry relate or potentially positively influence sleep?
Yeah. So today, because of our technology, we see things we've never seen before.
Mhm,
So as we look at these pillars of oral health, which is aesthetics, structure, function, and biology, when you look at those four pillars and this technology ladders up to each one, I could
mhm,
break it down for you, but let me start with sleep. Structurally, what happens with sleep is that we can't breathe. We can't breathe because we're either breathing through our mouth, not our nose. Our nose was designed for breathing. By breathing through our mouth, we dry out our mouth, but most importantly is we can't get into deep reparative sleep.
mhm,
Drying out the mouth doesn't allow saliva as a buffering agent to put the right environment for the good bacteria to thrive. And drying out the mouth doesn't allow the saliva to keep things neutral so you don't demineralize the teeth, because it's either demineralizing without saliva or remineralizing with saliva. So let's go back to sleep. If you're breathing only through your mouth, you can't get into this deep regenerative sleep. If you can't get into deep regenerative sleep, you can't fight the oxidative stresses and the environmental toxins and everything we put our body through during the day. And that's why these sleep trackers are amazing, because it allows us to look at REM sleep, light sleep, and deep sleep. So anything we can do to get into this deep sleep and get the right amount of sleep, but the quality of the sleep is critically important. So now we look at nasal obstruction, which stops us from not breathing through the nose, forces us to breathe through the mouth. And then we look at jaw size. The tongue lives in our jaws. What happens if the tongue cannot move forward when we sleep? Because that's a normal posture. That's a myofunctional position.
mhm,
The tongue could be up and forward, which is the correct place to be. It almost happens naturally when the tongue lives in, let's call it like where we would live in, we hope to live in a penthouse, but we don't want to live in a studio apartment. It's tight. Those small jaws forces the tongue backwards. Also, myofunctionally, the tongue could be in a low position, low tongue posture. Another problem that you can't get your tongue up and forward. Now, why is that so important? The tongue, when it moves forward, opens the airway. So we look now at the circumference of the airway. Part of sleep disorders is upper airway restricted syndrome, URS. So between the nose, the mouth, the jaws, and the airway, guess what? Us maxillofacial prosthodontists, that's my specialty, I'm a prosthodontist, orthodontist,
Mhm.
general dentists also who understand sleep, sleep dentists need to work collaboratively with our sleep doctors, sleep tests to understand are there structural issues. 40 million Americans have sleep problems, except those are the people who know they have a sleep problem. There are so many people. We think almost 80 to 90% of all adults have some form of sleep issue, whether it starts with a little bit of snoring or slight to moderate sleep apnea. But it's sleep disordered breathing, or is it breathing problems that create disordered sleep? So Roger Price in Australia, who's been studying this for 40 years, has an amazing, amazing book, gets it right. So it's breathing disordered sleep, BDS,
Mhm.
and not sleep disorder breath. And when you think about it, it's right because the structures of our from the top of the nose to the airway will determine how well we get into this deep sleep and we can regenerate our body, which is really a huge driver for longevity and why we call what we do the Center for Dental Longevity. We believe that the mouth, the health of the mouth and the structures around the mouth will lead to overall health.
Mhm. No, it's tremendous, and, to put it in a statistic, like 80 to 90% of adults have some form of either airway obstruction or a, breathing-related disorder that would tie back to overall mouth and nasal health, right? It's tremendous, it's scary at the same time, but it also opens doors for you as a trend center, as a dental longevity clinic to say, well, your one clinic right now, is in New York. And what are the opportunities for hotels to partner with you? So that way, when guests are flying in to a city as popular as New York, the hotel could say, "Listen, as part of our wellness services, we've partnered with Smile House, and we want to send you over there for a mouth mapping exam."
Yeah. Yeah.
Yeah.
Well, we love partnerships. And this new technology and what I was describing, I want your listeners to understand this technology, the CT scans, we call them CBCT, computerized tomography. We see so much, and it's equivalent to about 7 dental x-rays. We see things now we've never seen before. This will be a standard of care in dentistry at least within the next 10 years. Right now, it's some of the specialists, the endodontists, root canal specialists, the people placing implants, oral surgeons, and periodontists. But for us, for the last 7 years, it's been a standard of care. So instead of taking all these 16 x-rays, which is much more rads, greater radiation, we're just seeing so much with this new technology. And these are the type of things that are going to work its way into dentistry and healthcare in general. Adoption, they say, takes about 17 years. So it's just the way it is. It's human nature that people could be slow on adoption. And then you have the Canadian word, I have to tell you, because I'm very friendly with Canadians, a knucklehead like me that wants to adopt all this new technology because I know that if we do and if we start using it, we're going to figure out what is this all about? How do we improve our health and outcomes, our health outcomes for our patients?
Wow, and this is all, in your proprietary mouth mapping that you've done to integrate, these scans as well as other tests, into one overall score or health risk profile for your patients.
That's exactly right. When we roll it all together, it's biomarkers, and we
Yeah.
have aesthetic biomarkers, structural biomarkers, and biological biomarkers, and functional biomarkers. We put these all together. There's about 80 of them, and we look at it from a perspective that anything we could measure is really this biomarker. The biological ones people understand. We're now looking at inflammatory markers from saliva, and we're 2 months away from, based on whether somebody has high risk for some of these inflammatory markers like MMP8, metalloproteinase,
Yeah.
that if you that's high, we then want to say, hey, you know what? You might have inflammation in your body that we need to really check. And so now we're looking at additional biomarkers just with some finger pricks and some of these smaller machines that at point of care in 20 minutes we can get some answers. This is very exciting. This is called DMI, Dental Medical Integration. And I'm
Wow.
working closely with a company called Henry Schein, which is the largest dental medical company outside of hospitals, with David Kochman from Henry Schein. And what we're looking to do is to bring this to the profession. So we're testing this in a few offices in the United States to develop these protocols. The company that's testing MMP8 and salivary glucose and also PG, the bacteria that is the inflammatory pathogen, the bad boy, is a company called Oral Geno. CEO Tina Saw. She's an amazing young dentist that put together an amazing team of people. I'm one of their advisors. I'm working closely with them. And that is the type of technology that will absolutely change a profession where quickly we can detect these things that then says, okay, you're at high risk for this. Let's look deeper. Let's unpack it more. Let's get to root cause and let's get upstream and prevent us from being silly and waiting too much to be a sickness healthcare model, but to get more of a wellness healthcare model. We believe the dental office can be the tip of the spear to get ahead of diagnostics for these systemic inflammatory disease because people go to their dentist more than they go to their primary care physician. So
Mhm.
us dentists can play such an important role in early diagnostics and wellness.
Yeah, and it's interesting because dentistry as well has always been disconnected, as you said, from medical care. And as we see this integration of medicine and hospitality with all these concierge services, longevity clinics, preventative medicine, now we're adding in this incredible new angle of dental longevity where you're bringing in elements of hospitality, and then I imagine hospitality will want to bring in elements and partner with intrepid and futuristic organizations like Smilehouse in terms of what you're doing. So,
Yeah.
yeah,
Yeah.
I mean, it's amazing
It's
that way.
exciting it's exciting to think about that, and
Yeah.
I love the idea of merging the 2 because we're doing it on our own. We're clearly not experts in hospitality. But, dentistry is so nascent, and dentistry, you know, there's so much fear around dentistry and angst and just experiential cues that are so negative that if we could just change a little bit of the patient's experience, we really can move the needle. And for us, we're really looking to do a lot of things together to change that environment and change the experience. And then people really, then they become open to it. You said it before, it's possible that, oh, I had a great appointment. I'm looking forward to going to my hygienist. I love my team. And they're learning things. They learn things that they never really understood before because it was like, okay, yeah, I gotta go. I gotta get my teeth cleaned. All right. No, this is part of my longevity. This is part of my health. This I'm doing for me. I want to do this for me, for my health. Right.
Yeah. I mean, and, the whole idea of looking forward to it, in hospitality, we look forward to our trips to hotels, and this is yet one more thing to look forward to by embedding true hospitality and following a lot of the tenets of, what Will Guidara wrote in, his book on his tenure at EMP, and it's just amazing that way that we can see this crossover and then a potential collaborations, with between dentistry and hotels, and whether that's structured as a head lease or as we discussed, putting a dental clinic in a resort down in the Caribbean somewhere. So somebody who maybe they live in New York, as you are, and then let's say it's 20 degrees Fahrenheit outside in January and a little bit gloomy, and they say, "Listen, rather than get my appointment here in Midtown, I'm gonna fly down to the Bahamas or to Barbados and have my treatment there." And then you have the same sort of experience there with great information transfer and everything. That's such a future opportunity of that's completely untapped,
Yeah.
and and it really will be so amazing to see.
I agree. I agree. I think we're gonna have to explore that one together.
Yeah. Well, I mean, happy to make introductions to make it happen because I'm a huge believer. And now you think about this. So we discussed the parasympathetic and doing any sort of dentistry work in a de-stressing, calmative environment. And
Yes.
there's perhaps nowhere more calmative than a resort when you're on vacation. So
Right.
now imagine you can get a dental appointment where it perhaps is something a little bit more cosmetic, and therefore a longer period of time while you're in an incredible tropical destination like that. So, what would that look like to make that happen? And also, let's also talk about some of the cool new emerging dental treatments that are available, like enamel regenerative technologies or keratin building gels, something cool like that.
Wow. How do you know about keratin building gels?
I have my sources.
There there are a number of such interesting technologies coming out. Well, peptides and a fantastic researcher named Dominic Lysek started about 20 years ago with regeneration of enamel that then turned into a company called Curadont
Mhm,
that now is in the profession, and it's very exciting. Vivardis has Curadont now, and what we're looking at is early incipient lesions. These just when enamel is starting to break down, and instead of it moving towards that pathophysiology, that progression, and turning demineralization, the hardest structure of the human body, a tooth, into mush, we are regenerating enamel with these new peptides. And it's just the beginning because then you have people, and there's a group that we're working with the keratin building. So it's funny you should mention that one out of England. And there's a number of people that are really looking at these precision targeted approach to go after these pathogens and also for rebuilding in a way that's fairly inexpensive. The inexpensive part is very exciting because we also have a foundation where we take care of people in these medical and dental missions. And we started in Eleuthera, the Bahamas, where people did not have any access to care, no training of oral health, or all of the habits, the high performance habits you have to keep your mouth healthy, and what are the foods you need to eat and to drink. So modern diet, sugary foods, very acidic drinks, processed foods. It's a cocktail for both oral health problems, and of course, that will drive hypertension, cardiovascular disease, and diabetes.
mhm,
We went into Eleuthera with the invitation of Lenny Kravitz. He's our foundation partner, our Glow Good Foundation, and Let Love Rule. And it's great when you have technologies that are going to be inexpensive that we can help people in these dental deserts. Because now, instead of having to have expensive restorations, it's much less expensive, and we can be preventative with the children and with the adults, for them with both periodontal disease and decay.
mhm.
So technology and breakthroughs are happening. It's a very exciting time in medicine and in dentistry. And I will say that we're finally coming together a little bit. We've had this opportunity to work with these integrated medicine groups. And from the foundation, we brought doctors and dentists and nurse practitioners and hygienists together, all under one roof. And for me, that was the inflection point that I said, "We can do this." So I have a clinic uptown in New York for 35 years, and that was really the genesis of why we decided to open up Smile House downtown in Tribeca. And so I have to thank the fact that we started that foundation mission and the invitation by Lenny, and we started this foundation we started in East Africa. But by going there and seeing what happens when these professions work together, these disciplines, is absolutely groundbreaking. And that was the genesis of Smile House, which has taken us down these very interesting roads.
Well, you mentioned something in the beginning there about dental health has a causative effect with cardiac and other circulatory diseases. Am I correct in using a strong word as causative?
Yes. Yes. Yeah, that's 22 years later.
Yeah.
Moisey Devereaux at Invest Studies started 20-something years ago, and what did they test? They looked at P. gingivalis, PG, the
Yep.
pathogenic bacteria, number one bad boy. There's 7 of them, and they found it in the carotid artery, in the intermedia of cardiovascular patients. Then they started doing more studies, and what they found was that as a patient who has cardiovascular disease and periodontal disease, as they lowered periodontal disease, cardiovascular disease measured by inflammatory markers, and the inflammation in the arteries goes down.
Hmm.
That was cardiovascular disease, and that's been 20 years of Invest studies with Devereaux's group.
Mhm.
Then you can look at the same thing with rheumatoid arthritis and rheumatoid factor done by Dana Orange and Rockefeller University. Then you could look at Andrea Kamer's group that started and saw that PG ends up with the gingipanes, the proteases of PG, in other words, the breakdown byproducts of these bacteria from the mouth. These bacteria, PG lives in the mouth. What is it doing in the amyloid plaque of Alzheimer's
Yeah.
patients? And what does that mean? That means you're getting inflammation. How did it get there? And now they've done these studies and they found out it goes through the cerebrospinal fluid. So circulatory system through the CSF, and it works its way into the brain. They find it in interstitial cells of leaky gut, and that's when the cells, the membranes, they separate in leaky gut, and you're getting these toxins from the gut into the body. Well, guess what? They found PG there. What's it doing there? And so it became clear that when you have chronic inflammation in the mouth, think about leaky gut. It's leaking. We have leaky gums. So in my new book I got coming out in a few months, we talk about these leaky gums because it's easy to think about. The gum next to the tooth, the endotoxins of the bacteria cause inflammation like a balloon. The wall thins and thins and thins because it blows up from the inflammation, the blood flow. And now you have permeability. Permeability meaning these endotoxins works its way into the superhighway we call the circulatory system. Where does it end up? It ends up in all these different organs. So this is the study of about over 20 years that shows this direct correlation. Once you understand that, you say, okay, what do I have to do to prevent it? And that's where the dental profession and the hygienists are phenomenal at, to teach people great techniques, to teach them the tools, the order by which you use these oral health tools. You got to have game. So you gotta have an oral health game just like a backhand. You gotta
Mhm.
practice, and you gotta have a coach. And the
Yeah.
hygienist is the rock star of the dental practice. They're amazing. And they're the ones who are the coaches. And they spend the time and make sure that we're doing a great job watching out for the mechanical removal of plaque from our mouth, not allowing it to accrue, not allowing our body that was designed to protect us, our immune response, to work against us with chronic inflammation,
Mhm.
and for these bacterial byproducts to work its way in the other areas of the body.
Yeah, to tie this back to hospitality industry, any luxury hotel owner or GM or CEO and any director of spa or wellness is gonna get it. They're gonna immediately go, "I know exactly what you mean. This is the future. We need to be doing more here, and we can be doing more." So, what would you say to any hotelier in terms of how they can get involved in the dental longevity space?
You know, it's all about the environment, right? We talked
Mhm.
about parasympathetic mode. Well, that's already established. You understand this so well that the partnerships work well when everybody brings their superpowers to the table.
Yep.
The
Yep.
hotel has set up this beautiful, incredible environment. So what they're saying is, let's invite in an integrative approach,
Mhm.
an approach where people, you can get your teeth whitened, you can get your mouth healthy, and you could learn about how your mouth impacts your overall health. And then, of course, you can have, your medical colleagues there also. But by working together, whether it's you're solving sleep issues or bruxism or grinding your teeth, or, your gums are bleeding when you're brushing and you just don't have that great oral health game,
Mhm.
this longevity is going to happen.
Mhm.
But so it'll happen as partnerships. It's like the old days when, if I have to go back to one of my first companies, but I was a big observer where the incredible beauty stores of Sephora opened up a store within a store, and they went into
Mhm.
J.C. Penney. J.C. Penney was run by an amazing CEO called Michael Ullman.
Yeah.
Sephora was run by David Sulitiano, the amazing CEO of Sephora at that time. And so that store within a store concept worked so well because Sephora didn't have to go build out all the CapEx of a whole store. JCPenney had it set up already. It's the same type of thing, but even greater because you have this incredible environment with the hotels. So inviting in longevity thinking, whether it's the physicians, whether it's the dental specialist, it is fairly brilliant because they're ready for that. And the people who go into hotels, they're interested in that. They're
Yeah.
interested in longevity for sure.
Well, one other aspect of wellness and longevity that they're interested in is this emergence of wellness circuits or multimodal wellness journeys, where you're taking a guest from a massage into a red light therapy lay down bed into a cryo, back into an infrared sauna, and then some time by the pool with some hot tea, and then could you ever see a point where dental longevity fits into that circuit and multimodal design? You mentioned I guess, the hypoglossal and jaw massages. That's something that could be integrated with a traditional massage as well.
100%.
Yeah.
Yeah, absolutely. I mean, think about you just maybe you got about 10, 12 touch points. Maybe
Mhm.
touch point 4, 7, and 9 becomes oral health.
Yeah.
We know the pillars of longevity, right? It's all about motion and movement. It's all about nutrition. It's all about sleep, deep sleep. And then it's also about mindset. So they've created this great environment for stress release and mindset. Well, I always say the fifth pillar is oral health. So I would work into all of those great multimodal steps where if you're having red light therapy, okay, at the same time, we're going to have stress release jaw massage. At the same time, we're going to do diagnostics and we're going to go after sleep. I have to say that the dental specialists and our sleep dentists are really the best at diagnosing sleep issues today. And from a therapeutic treatment standpoint, we really are doing it the best because we have so many options besides just what the medical profession has today, which is a CPAP. But
Mhm.
we need the medical colleagues, the dental colleagues to work together. So I see it working beautifully. It's just figuring out that patient journey and how to do it in a way that's, super positive, but super educational at the same time.
Yeah, the possibilities are endless, and you tied it right back to those myofunctional exercises or uh, laryngopharyngeal exercises, or for the layman's term, I guess, just tongue and jaw exercises, right, to help with
Exactly.
sleep and your mouth posture while you're sleeping. And you think if you have a dental longevity clinic in a hotel like New York or London, somewhere like that, somebody flies in, they get a treatment at the dental clinic, as well as an education system in a great inviting place, and then they go to sleep, and they may have had some jet lag or something like that because they're flying, and they're able to better recover, and then go off and make a good presentation the next day because their sleep score was 85 instead of 45. Something like that, right?
Right.
Yeah.
Exactly. Yeah, and then you would have nurse practitioners with IVs, and in the IV, you would you're traveling, you get dehydrated. Now you're hydrating. Maybe you have glutathione, which is a scavenger, and you're just adding in, your B vitamins we could just kind of name it. And so that's one piece of that puzzle where you're bringing that person into a tremendous state of health as you hit all those touch points, as you hit
Wow.
it. So it's very 360, very exciting, very comprehensive.
Yeah, and there's been an incredibly impactful and comprehensive, episode and just discussion to learn about the importance of dental health and how it can integrate and is integrating with hospitality. Um, so Dr. Levine, to close out, is there anything else important that we haven't touched on that you'd like to mention?
Well, I'm really excited about this, and I mentioned it before, but I'm very excited about the dental profession and the medical profession working closely together. That will happen in a very big way when medical schools and dental schools are both teaching what's called oral systemic health. What is oral systemic health? It's how the mouth impacts the body and vice versa. Unfortunately, there is no dental school or medical school that's teaching any of that. There's a couple of schools in dentistry that have some classes. It's just like the story when I was in medical school for the first 2 years, and at Boston, you then went over to the dental school, and then I did a postgraduate for 3 years for prosthodontics. But, in medical school back in the day, there was 0 on nutrition. Today, there's only 52% of medical schools teaching nutrition today. One of the most important pillars. Tell me. Well, we can then look at dentistry, and dentistry, not teaching nutrition and medicine is as bad as not teaching oral systemic health in dental schools. And I'm involved in dental education. Full professor at NYU. I ran a program for decades. This is one of the things that I'm singing, and I'm going to be looking to push that into NYU. This oral systemic health is so critically important because of all the things we're talking about. So, I would say to the people listening, get educated, learn how important oral health is to your overall health, and demand from your dentist a high level of understanding. Are they doing oral cancer examinations? Are they doing salivary diagnostics? Are they looking at your microbiome? Do they have a CT scan and understand how to read it? Push them to do that because the consumer patient will push the professional out of their comfort zone because professionals get a little too comfy. I'm an old lacrosse player. I coached lacrosse for 20 years. And I like pushing people out of their comfort zone. It's part of, as you know, Adam, being an athlete. That's what a coach did for us. That's what we want to do for people. So push them out of their comfort zone and give them a nudge and make them find out what is the best technology I need to have and how do I continue to learn over time in my career.
Yeah. I mean, and if you look at it itself, the studies on expanding your own comfort zone, you're testing your own boundaries is incredibly important for longevity as well. Working on a completely different pathway than oral health, but nevertheless, the end goal of having a sound mind and living with well-being and health span, it is connected in that way. So
Yes.
um, I would explore everyone to look at what Smile House is doing in Tribeca in New York, and then look at it and go, well, this whole idea of oral health and dental longevity is such a underexplored area, and yet it's so vital for where we're heading as a society over the next 20 years. Dr.
Love
Levine,
that.
thank you so much for coming on the show. It's been fantastic to learn about what you're doing, and it's incredible what you've built and what you are going to continue to build as people catch on to this trend and want to be a part of it.
Thank you, Adam. I appreciate it. As you know, I just say, we're just getting started. Let's let's go. Let's go. We're just getting started. I'm a lucky guy. I got my 2 sons along the ride with me and my wife, so we're having fun.
Wow. Dr. Levine, thank you.
Thank you, Adam.
Thanks for listening to the Gain Momentum podcast. To stay up to date, make sure to follow or subscribe wherever you get your podcasts. For more information about Gain Advisors, head to gainadvisors.com.